It gives me great pleasure to welcome each and one of you present here today. To begin with, I would like to extend a hearty welcome to Professor Mahesh Savalagimath sir. Sir needs no introduction. He is very famous throughout the country. Professor Mahesh is presently working as a professor in the Department of Agatantra at KLE Belgaum, Karnataka. Sir is very well known for his clinical abilities and his interest both in academics as well as research. Sir, in a very young age, he is very instrumental in bringing out the hidden talent of Agatantra. He not only proves that Agatantra is a clinical subject, but also fights for it, motivates children, kids, teachers, and all his colleagues around the country to do their best wherever they are with the minimal facilities available, to do their best so that we can bring out this clinical subject to the utmost necessity as of today. He has also been very instrumental in adding quite a few clinical aspects in the new curriculum. And today, therefore, we have utilized his talent here to motivate all the teachers and all the academicians in Agatantra around the country. We have taken up for today a very apt topic, which has been added newly into the curriculum. Dermatology has been given lots of importance, and hence, in order to help all the teachers to understand what it really includes and what are we supposed to teach the student, we have organized this webinar, and I take this opportunity to wholeheartedly welcome Professor Mahesh Savalagimath sir to this webinar. A hearty welcome to you, sir.
Thank you,
I also welcome Surendra Chaudhary sir, who is very instrumental in motivating all of us to do our best in Vishwa Ayurved Parishad. And he is one among us, irrespective of which clinic branch we have taken up, irrespective of the subject. He supports us, guides us, and encourages us to do the maximum possible to improve the academics. A hearty welcome to you, sir. And I heartily welcome the convener of today's program, Dr. 𝐂𝐱𝐩𝐿, all the other respected members who have joined this. We have a total number of participants as 60. I don't know whether it is the Professor Mahesh Prabhava or the topic as such, but we are very happy that many teachers have joined this webinar today, and they will be utilizing the topic to the maximum. So we expect a debate also at the end maybe, or interaction, an interactive session with Professor Mahesh, so that we are clear on the aspects of what is to be taught to the students. And I can see Anil Shukla sir and many more. In fact, I don't think so it will be apt for me to take a lot of time for welcoming each and everyone who is present here today. I take this opportunity to welcome you and hope this webinar will give out its maximum to all of us. With these words, I will once again welcome each and one of you present here. Thank you. Over to you, 𝐂𝐱𝐩𝐿 sir.
Yes, I want to give the guest speaker introduction. Mahesh Savalagimath, everybody I think knows that he is a professor, renowned professor in KLE Ayurveda Mahavidyalaya Kankanamadi. He has a vast experience, 15 years of vast experience, clinical as well as in all the, especially principle of dermatology practice. We know that he is my colleague and he is my very inspirer, and he is a very great scholar with minimal time. He has even he has his own academy of dermatology practice. He has taught many students, disciples, and he is a renowned scholar. I want once again, I think no need of much time. I welcome Mahesh once again, and let us go to the Mahesh. Please, sir. Please, sir.
Thank you, sir. Thank you. कुछ नमस्ते एवरीवन. दोनों ने कुछ ज्यादा ही बोल दिया. Not that much. Anything whatever I am doing is it's very little bit. Okay. Anyhow, thank you very much for your introduction. And whether my slides are visible?
Yes, sir.
Visible, Mahesh. Visible.
Okay. Just a minute. Okay. Okay. Namaste. Good evening, everyone. This is I have kept the title same as we are. It's a part of 𝐶CM curriculum, so that is why I kept it here. So before we go into the subject, like I have just a minute. My slide is stuck. Okay. Now, why we have made so many changes in this syllabus? Not removed anything, basically. Some things are added. Why those changes are made? Somewhere I was just giving, I went to a college, Badami College, where we were having a discussion on group discussion on this syllabus curriculum. So main thing is the changing needs of healthcare. Healthcare is changing, the needs are changing. So as per the need, if we are not going to change, we will be left behind. So it has happened a lot, because when I just want to give a simple incidents in 2014 or 15, we had a inspection, CCM inspection was there. At that time, one member came to our OPD. It was my OPD on that day. And that madam started shouting at who gave you the permission to run Agadatantra OPD? How can a Agada person can practice? Something like that, that I felt very bad, and I actually fought with her. Then Prasad sir came there, and somehow it was, that was like a quarrel fight. So why it is happening? Because we are being neglected. Why? Because we are not doing anything such which is current requirement is there. As per that, we are not doing anything. So means we are not updating. So that is what is the need. When health care needs are changing, we need to change our things. Here, actually, I have taken one quote from, this is a quote from movie Undisputed 3. It's an English movie. In that, it's about a fight. Okay, in that, this is the fighter wins the match with this principle. It is taught by a very senior retired person who has stopped fighting and all. So he teaches him adapt, improvise, and overcome. So what Agada Tantra so far have done is, it has done just adaptation. We have adapted as not like what it was there in Samhitas, but rather we adapted it like what modern toxicology, forensic medicine and all is there. So we adapted it like that. So we need to change it, right? We need to improvise to come to the healthcare, changing healthcare needs. So that is why we need to improvise. If we improvise and if we work on that, somehow we can overcome the challenges, and we can have our own identity as Agatantra, as a established clinical branch. Now, for that purpose, so many changes have been made in the syllabus. So this need to be brought into our knowledge, attitude, and practice. It should be it should be showing, it should be seen in our knowledge, our attitude and practice. And so that when teachers are having that type of attitude or practice oriented mind, then students will learn. Simple thing like, Prasad sir used to say, if a teacher comes to the college in a bike, two-wheeler, then how can such teacher teach a student to buy a Benz or something like that? No, it is like that. So when teachers are not, when we as a teachers, if we are not having that level of knowledge or attitude and practice oriented mind, then 100% it becomes very difficult for teaching, as well as for the students to learn and adopt it in their clinical practice. So that is why some changes have been made. These are not very big, they are very simple changes. So in that, today we are going to discuss about this clinical related topics. Okay, now actually, Madam was telling we will have a debate. No, we will not have a debate. We will be having discussions. Okay, discussions are better than debate. Okay, these are the points that are added into criteria. Topic number 7: dermatological manifestations of Visha poisons. Even time allotted is not that big. 6 hours lecture hours and 2 hours non-lecture hours. The points here are contact dermatitis and its management. Signs and symptoms of management of Abhyangavisha, Alepavisha, Vastravisha, Padukavisha, Abharanavisha, etc. with contemporary relevance. 7.3 significance and signs and symptoms and management of dermatological manifestations due to cosmetics, chemicals, occupational and other allergens. Dermatological manifestations due to Dushivisha and Garavisha. Dermatological manifestations due to bites and stings. Okay, these are the points that are added. In this, some are very much direct. They do not require. For example, the first one, describe clinical presentations and diagnosis of Padukavisha, Abharanavisha, Vastravisha, Lepavisha, Abhangavisha. These we have to teach based on the classical reference only. Right? In textbook, we have quotations for everything, for all these things. Okay, we have a reference for that. Now, when it comes to teaching them, slight we need to be little bit here. It is what is here is we have given like lecture PPT discussion, case based learning, or anything like that, where it's not mandatory. Whatever things are given here, teaching methods are not compulsory that you have to follow them. If even if you have a better solution for you, for example, case based study, if you are having live case, it's very good. If you have clinics, then in clinics only you can teach. If not, if they are not available, then you can go with the published cases also. Okay, published cases can also be very useful to teach these topics to the undergraduates. This is for undergraduates. See, for undergraduates, we are not making them as specialists. Only thing is, as I told, attitude. Attitude is to be changed. Means we need to bring in attitude in the undergraduates that Agada Tantra is having clinical importance. Okay. And what are the areas of clinical importance? Those we have to show. Now, what has happened is before the NCISM syllabus changes were made at that time, or something was there at that time, somebody wrote a mail in that it was very few people practicing snake bite management, other things, why Agatantra is giving so much importance and all. See, this is what, this question is there because the need is different. Right? Snake bite management is not that prevalent everywhere. Snake bites are not that, incidence is not that relevant everywhere. Even if it is there, then everywhere the question asked is whether you are going to violate a WHO protocol. No, as per ethics, what is recommended is legally as well as ethically, you have to go with the add-on treatment or go with the modern available treatment. So we cannot change that one. We cannot remove that treatment. So whatever is there, even if we are expert in that, legally and ethically, we are bound to go with WHO protocol or antivenom and all. So when that is limited for a particular geographical area, so imposing it compulsorily on all others is going to be a kind of burden, may not be possible. And because of that, what so far people of Agatantra were feeling that we don't have any clinical importance, we don't have clinical importance. But there are areas where we can explore the principles of Agatantra, like these Paduka Visha, Abharana Visha, Vastra Visha, Lepa Visha, Abhyanga Visha and all. Here, what is said here next is discuss the management. Management is also same. What is there in this? I will be giving you examples. I will give you examples for this and then I will explain. Now, for example, here case diagnosis. In this case diagnosis, only thing what we have to give is we have to take even if you are not having a documented case, anyhow, you will be documenting very sure in future. So go to any website, Google, you just Google and search, download a contact allergic footwear dermatitis or contact footwear dermatitis. You will get an image. So collect such multiple images, one with more oozing, one with more swelling, another with very dry presentation. Take some photographs of such. Even you can take a simple soft copy, display them in front of the students, ask the students to assess. First, ask them to assess, or you can have contact dermatitis. Another one is simple, other dermatitis, like the shoe bite or something has happened only on one leg, the patient is having a lesion. You put both the images, then ask the students which one is Paduka Visha. Then they will be telling that. If they are not telling, then you will be explaining. Then give same photos, same condition of multiple photographs, and then ask them what is the dosha assessment in this. Well, like there is oozing, more clay is there. So what is the probable dosha involvement in this? Okay, they will try and they will tell. If they are not telling, then we have to teach. Like it is having more pitta and kapha. If it is a highly dry lesion, so it is having more vata along with kapha. Like that, even if we want to teach, we can teach from anywhere. Okay, there is no restriction to use any data that is available on Google. Only thing is, we are not supposed to, we should not claim that it is my data. Okay, so only thing that. Okay, now AI is developing a lot. So even if you want to teach, you can use ChatGPT also. ChatGPT, something is there. No? So in that, you just search, you just go and find, give me maybe like 100 line notes on contact dermatitis. It will give. Only thing is, it will not give you references from where. But for the teaching purpose, that is enough. It gives scientific data. Okay, like that we can use, or any dermatology book you can use, and by that you can use. Now, case-based learning is that. Case diagnosis is also like that. In management, now management, if you are not practicing, okay, if you have not documented, No problem. What classical management is there? That we have to teach. Now, in that, the drugs that are explained in that classical management may not be available. Okay, they are not available. Now, only two things we have to teach them. What is that? What is the dosha, involvement, and what is the cause? Now, cause is Visha, because we are telling it as contact poisoning, like, Lepa-Visha, Abharna-Visha, whatever it is, a contact poisoning. Now, as it is contact poisoning, we are going to tell that you give either Bilva-Degada, Dushivisha, something like that. One Vishagna we have to tell. Then comes the Shamana Aushadhis, like which dosha dominance is there. Like if Kleda is there, okay, do Seka with Tripla Seka or Panchavalkala Seka, you do. Then if it is more burning is there, you give some Pittahara drugs. If it is more having Shota, you give some like Punarnavadi Kashaya, something like that. If more itching is there, you give Nimbadi Kashaya and all. Like hardly some 10, 15 medicines, even if you just read once and twice, you can 100%, what I can say is not only teach, but practice also. But you can practice also with those principles. Okay, only thing is we have to teach first what is there in text. Then we have to take the principle from that. What principle and what principle the treatment is explained. Okay, based on that, we have to give the medicines, how to do that one. Okay. Like contact dermatitis and types, its types, it is purely modern. It is purely modern contact dermatitis explanation, its types and all. It is same. That is why regular lecture is there. So whatever modern is there, you can teach or you can give them for, in this 2 hours NLH is there, non-lecture hours. So you can give this point for reading also. Or you can have a flipped class. You give some topic, let them read, and then they will come to the, like, whatever teaching methods are explained here, not compulsory that you have to follow them. Okay, you can change them as per the resources available for you people. Okay, because we are now in the budding stage, we need to be coming out with some solutions. Okay, for that purpose, you can modify the teaching methodology, whichever you feel suits best for your students as per your geographical, your state or your place. Like that, you can teach. Next is discuss the application of treatment principles of Agarthantra in contact dermatitis. This is nothing but this same management of Paduka Visha Abharna. Now, what is the contemporary aspect of this? This is contact. In this contemporary aspect is contact dermatitis. In that particularly allergic contact dermatitis. That is what we are calling as Lepa-Visha. I will show you photos of patients, then you will understand that one. Okay. So Agarthantra principles means now hello. Okay. Agarthantra principles means I actually teach this based on two things that from Chaturvimshati Upakrama. In Chaturvimshati Upakrama, we have Prativisha, Prashamana, and Aushadha. Now, Prativisha is administration of Visha in Visha condition. Okay, that we will leave. Next two entities are there which are very important. One is Prashamana, another one is Aushadha. Now, Aushadha means Vishagna Beshaja. Aushadha means Vishagna Beshaja, but it is not containing any Visha in it. Aushadha means Vishagna Beshaja, but it is not containing any Visha in it. So that is what. Now it is given for the Hetu. Means by what? Now it is caused due to allergy, footwear allergy, textile allergy, dye allergy, or glue allergy, whatever allergy, cement allergy. For that, blindly we are giving one Vishagna Dravya. Okay. Either give Bilva-Degada or Dushivisha or Dashanga, depending on clinical presentation. Okay. Assume you are giving Dushivisha. It is allergic now. Now, Prashamana is there. Like Prashamana, how it is explained, for example, in case of, what is that? For example, Mandali Visha, there is severe burning sensation. What is done there? Chandana Ushira Seka is there, right? Chandana Ushira Seka is Prashamana. It is used to treat the Lakshanas, right? Karya, not for Hetu. For Hetu, Aushadha is given. Now, this Karya, Prashamana, from where we are going to select? We are going to select them either from the Agarthantra or from Kaichikitsa. So what is needed is blending is needed. We need to blend, like for example, Patola Katrinadi Kashaya. Nowhere in Visha Chikitsa, Patola Katrinadi is directly explained. Only thing is in Gana, it is said Patola Katrinadi is there, Pitta Kapha Shamaka, and simultaneously Vishagna also. Okay. That we are using here because in given condition, there is Pitta and Kapha dominance. Okay. Now in this given condition, there is itching more. So we are using Nimbadi Kashaya. From where we are taking it from Kaichikitsa principle. We are using it as Prashamana, right? Like that is the application of principles of Agarthantra. Means same. discuss the application of treatment principles of Agatantra in contact dermatitis. Contact dermatitis means we have to consider it into bracket, or we have to consider it as contact poisoning. Okay, allergy, we are considering it as contact poisoning because the contact, because of whatever chemical has come in contact, we are considering them as low potent poisons, right? We are considering them as low potent poisons. So we are going to consider that contact poisoning. Instead of contact dermatitis, in Ayurveda, if we convert it into English, we are going to teach it as contact poisoning. Like that, it should be done. Now discuss the dermatological conditions caused due to Gharavisha and Dushivisha. This, I think I will explain with the case only when I will be telling you some cases, because this directly we do not have any reference, right? But if we read Charakacharya's version, Dushivisham to Shonita Dushtaru Kitiba Kota Lingam Che is said, right? When Dushivisha enters into Rakta, it causes skin manifestations, right? Like that it is said. So that I will explain you it when I will be explaining about, because in this there is no direct, in this there is direct, right? In contact poisoning, that is Lepavisha, Abharnavisha and all, here direct is there, okay? But in Dushivisha and Garavisha Janya, there is no direct. We have to elicit it. We have to, do a kind of proper history taking. We need to dig in the etiology. Then we are going to come out with that, right? So how that is to be done, I will explain. Now discuss the application of principles of Garavisha, Dushivisha. That again, I will explain the case. Next is discuss the diagnosis and application of the treatment principles of 𝐾𝐈 in dermatological manifestations due to bites and stings. Now, almost 90% of bites and stings, except like, scorpion, sting and all, most of them have dermatological manifestations along with, if it is Pranahara Visha, along with systemic presentations, they have, dermatological manifestations. Now, what is to be done? Again, same principles we have to use, right? Vishagna and Shaman. Out of Chaturvimshati Upakrama, we are taking Shamana and Vishagna. Vishagna, we are taking like it is a 𝐾𝐈. So go with Bilvadegada or the Shangagada. Okay. Now, based on the dosha assessment, you can go with other medicines like Panchalkala is explained in 𝐾𝐈. You can take that, or Trifla Kasha you take for washing, or you can take like Shota is there, you can use Punarnavadi Kasha. It is very simple. It is very simple. Like that, we can use. I will be explaining those things with the case. I think then it will be very clear. Okay. Next is, it is in the activity, I think. It is the activity. In that, there is a dermatological manifestation of Visha. On this, there is one activity. So this activity, what is given is, this is very simple. For this, I am preparing something and it will be sent in a very short span of time. Okay. Now in this, like group discussion is there. What it is said, photographs, case reports, simulated cases showcasing various dermatological presentations of poison, bites, stings, contact dermatitis shall be given to small group of students and asked to assess the dosha, diagnose and discuss the plan of the treatment, right? Or CBL. In this, CBL means case-based learning. Presentation of recorded cases or case reports or studies which are already published in what you can call reputed journals, means which we can trust. Okay, trustworthy journals. Or after doing these things, you can do also brainstorming or quiz, so that like an assessment. It can be like, assessment. Just now I was telling like the same pictures may be shown with MCQ or quiz session can be conducted among the groups for that. Okay. Now, for example, now actually now we are having the elective course. Likewise, in KLE, in our college, we started a choice-based credit course or elective course in 2012 or 13 only. In that, from our department, we conduct toxicodermatology. 50 hours toxicodermatology means for 50 hours, we teach dermatology from Ayurveda. Agadatantra, applying Agadatantra principles in dermatology. And here in the NCSM syllabus, it's hardly 6 plus 2 hours is given, 8 hours. Means that much content is there because we have OPD, that is why we have developed. But no problem. You too, I'm very confident. Everyone, each and every Agadatantra department will have a huge lot of data in future by the time they start running their OPDs. Okay. So what we are doing the first day, what we did, we taught what is the scope of toxicodermatology, means why we need to do that one. Next, what we did, we went with what these Padaka Visha, Abharna Visha and all, we explained. And for each, we showed the photographs. Okay. Then in the practical, we gave the photographs and we asked them to assess the doshas. First day. It is done for 8 days continuously. So first day, they will be assessing the doshas. Okay. Next day, we'll be giving same for assessing the name of the disease. For same photographs. They are doing them. In the previous class, these are taught again to improve their understanding. We will be asking them to diagnose it by name. Okay. Same day, second day afternoon, we'll be asking them to diagnose it with modern name, modern diagnosis. You make modern diagnosis. Third, fourth day treatment aspects will be dealt in the class. And fifth day, we use same again. Then we ask them to write all the three. Four, diagnosis, Ayurvedic diagnosis, modern diagnosis, then dosha assessment and treatment. Treatment means not necessary that they have to write the medicine. No. We ask them to write first principles. If you are sure, then if you are confident or if you are good, you can write the medicines directly. So principles means, so there is 𝐜𝐨𝐧𝐿. So in this patient, we need to give by Bahir Paramarjana, we need to give Seka with Kashaya Rasa, Shita Virya. That is enough. Shota is there. We need to give Shota Haradravya. Visha is there, so it is contact. So we should give some Vishagna Dravya. That is enough for secondary MS students. Do not worry that you have to teach them medicines only. If you teach, it's very well and good. And I'm very sure that out of 100 students, hardly 10, 15 students are going to grasp all those things. Okay. And by the time they enter into final year, they will forget that also. So don't worry about that. What we need to make sure is their attitude about Agadha Tantra should change. Once that changes, 100% in future, they will start showing importance in Agadha Tantra and Agadha Tantra will grow. Okay. What is that? Now, I'll show you some cases. Okay. Here it is a case. Now, there are many people, I think these patients have been already discussed, but the perspective was different. Here, I will not be explaining in detail about medicines. Okay. I think I have 1 hour. Another 20-25 minutes, I'll complete. Now, this patient was, patient came with this vesiculobullous presentations. Now, what was the cause here? In this patient, what was the cause? The cause was, she had a sprain. She fell down and she had sprain. For that, she consulted a modern doctor and the doctor gave one, this is a gel which contains analgesic as well as anesthetic agent. 2 agents are there. So she applied that one and then without, as education was not there, patient was not educated how to use it. She applied, she massaged and then she gave steam to that. Okay. So by that second day or third day, she developed that one. So what we did there, we assessed it as allergy, as 𝐿𝐴𝐵𝐿. She has applied that because of that, or to that some other things are added, but ultimately that gel was the cause. So we consider that a chemical allergy as Visha. When we assess the dosha, it is Pitta dominant Kapha. So what is to be given? Vishagna plus Pitta Kaphara Chikitsa. Right? Vishagna is Aushada, Pitta Kaphara is Prashamana. There is no restriction. You should not, you can use any medicine which is having Kushtagna as well as Pitta Kaphara presentation, like Pitta Kaphara Karma. Okay, that is enough. Now, what we did in this patient, we gave Patala Katranyadi, Bilwadi Gulika, Panchavalkala Seka, Nalpamradi Taila. Okay, now in same. Patala Katranyadi, Bilwadi here, Bilwadi Agada is Aushada, Patala Katranyadi is Shamana, Panchavalkala is again Shamana also, we can also say Aushada also because Panchavalkala is Kitavishahara, right? Nalpamradi. Now, Bilwadi is Aushada, these other 3 are Prashamana. Now, what happened here? Complaints reduced a bit, but swelling was more. Other things reduced, swelling increased. So what we did, we kept same everything again to that. Here now, chemical allergy is still persisting. Dosha is Pitta dominant. Now, what is there? Patient is having Shota. So, Vishagna, Pitta, Kapha, Pitta, Hara and Shotagna Chikitsa. Okay. This way, if we teach our students, that is more than enough. That is more than enough. So, we are treating the Hetu also, we are treating the Linga also. And we are very, we are selecting the medicines. Aushada also, what you can call intelligently. So, Shotagna is to be added. So, same thing we did, we added Punarnavadi Kashaya, right? You can see the outcome. Patient is completely all right. Okay. Now, this girl developed these lesions and she was very much, worried about this. She was thinking that it may get converted into leukoderma and all. She developed this as a result of, again, 𝐿𝐴𝐵𝐿 only or contact poisoning because the glue allergy of the bindi which is having that gum, the glue that has caused this. Usually not like, this may not be possible always. What has happened is it happened in the summer, I think. We had some sports and all. So at that time, more skin will be more sensitive. At that time, some reactions may be caused. So she developed this one. So what I gave Dushivisha and coconut oil external application. Dushivisha, we considered it as the low potent poison, that glue, and Shamana is coconut oil is needed. Pitta, Vata is there. So I gave that one. After 3 days, you can see the presentation is completely gone. And this pigmentation takes another week or so. It took so much, maybe a week or so. She is perfectly all right. Again, Aushada Prashamana. Dushivisha is Aushada. Just a minute. So Dushivisha is Aushada, coconut oil is Prashamana. Right? This one is again Lepavisha. Okay. One more area of where we can use and we can teach the students is the vesicular-bullous disorders. Because Acharya Sushruta says Visarpa can be treated in the line of 𝐾𝐸𝐵. And it is very important. When we treat Visarpa with the line of 𝐾𝐸𝐵 Chickisa, I have not seen a single herpes patient I have treated so far has developed post-herpetic neuralgia. Okay. Most of the patients aged above 50, if they suffer from herpes zoster, 90% of chances of developing post-herpetic neuralgia is there as per the modern medicine, and it is seen. So when we treat that with 𝐾𝐸𝐵 Chickisa, there will be no post-herpetic neuralgia. Okay. And even we can treat post-herpetic neuralgia with the same 𝐾𝐸𝐵 Chickisa. Okay. Now here what we gave, Patola Katranadi, Pitta Kapha, and Vilwadi, Agada. Okay, 5 days treatment, you can see the outcome. It's very simple, right? It is very simple. Only thing is we need to read. We need to read very few medicines, not very big. We can ask the students also to read them. There are very few medicines are there. Hardly. Best way is to concentrate on the drugs which are market available, right? Which are available in market. Most often what happens now, people say that this one is not available, that one is not available. I don't know, it's for entire Ayurvedic fraternity or we Indians, that we always complain of something which is not there. We never respect what is there in front of us, right? So yes, it's a time to change our attitude. We need to respect what is there with us. Just imagine, like, simple thing. Last time I was presenting something and I was talking about Vidanga, how best it works in psoriasis in prevention of recurrence. One of the persons stood and he asked, like, Vidanga which is available in market is not genuine Vidanga. How to trust that one? No, actually it is, I felt like I just answered that when genuine Vidanga is not available, existing Vidanga itself is giving such a result. Imagine what will be the outcome if we get genuine Vidanga. So choice is ours. Choice is left to us. Whether we need to wait till we get the genuine Vidanga or we should start with what is available with us. Right? That is the one. Now, this is also again same herpes zoster. So same Patola Katranadi. See, I have tried to keep such patients which are having same medicines so that you can start practicing, right? You can start the OPD. Not only I'm not just telling about how to teach, but simultaneously a little bit that changing of attitude for that purpose. Okay. Please don't take me as otherwise. Okay. So here also you can see herpes zoster, Patola Katranadi Kashayam 4 times a day. Because we needed Virechana type of effect 4 times a day. Vilwadi 2 tablets thrice daily after food. External application of Panchavalkala Seka was given. This is after 5 days. In herpes zoster, most often what happens, we lose the follow-up. After 5-6 days and all, when symptoms becomes completely, clinical presentations reduced, the follow-up will not be there. That lady, she was, this madam is mother of my colleague. So that is why that patient remained with us. Okay. Now that is how we can use in herpes also. Okay. Now 𝐾𝐸𝐵 presentations. I was telling 𝐾𝐸𝐵, dermatological manifestation due to 𝐾𝐸𝐵. Now one thing is, even if we are not getting 𝐾𝐸𝐵 presentations, we can use 𝐾𝐸𝐵 Chickisa in vesicular-bullous disorders, other vesicular-bullous disorders. Now 𝐾𝐸𝐵 also comes with dermatological manifestations. Now you can see this girl, aged around 12 or 10 maybe, she came with this type of presentations on both the legs. Okay, it was diagnosed as leukocytoclastic vasculitis. Okay, she had this on both the legs. She was not able to walk There was joint pain, edema. Okay. She had slight pain abdomen. As per the modern morphological diagnosis, it was correct, like leukocytoclastic vasculitis. Okay. She has been treated with antibiotics, analgesics, and when she came to me at that time, she was still on 40 mg steroids. Maybe Vicelon was there, not sure, for per day. Okay, this was the diagnosis. It's a type of hypersensitivity reaction. Now, I told history taking place we should learn history taking. For Agada people to elicit hetu, history taking is very important. We should inculcate that in our routine practice to talk to the patient. We should not we should not be in hurry to prescribe medicine. We should be very careful in assessing or taking history. So in this previously treated dermatologist has not asked anything. What has happened here is she has been to Kolhapur somewhere, and she was in her grandmother's home. While playing, she just stepped on an anthill. Okay, there were red ants, so many, and she got bitten by multiple ants. And the kids, they will be busy at sports playing, and she just wiped them, neglected. After 2-3 days, she started developing these reddish papules on both legs and consulted modern dermatologist, and it was diagnosed like that. So when I took the history, I came to know about this. So our diagnosis was Pittaja Kitavisha. Agneya Relpasansravo, Daha Raga Visarpavan, Pakwa Pilu Falaprakya, Karjura Sadrusho Atava. So same presentations are there. Srava is not there, right? Daha is the severe burning is there, Raga Erythema is there, Visarpavan, it is spreading. Even she had on abdomen and upper extremities also, right? So we considered it as Kitavisha, Pittaja Kitavisha. Again, same medicine, see, Patala Katranadi, Bilwadi, Dushivisha, Nalpamaradi, right? And we started tapering the steroid and stopped. As we started tapering the steroid, the complaint started aggravating, lesions started, but severity reduced. And we educated the patient before only that it is going to aggravate. So they cooperated with us. You can see again the lesions. These are the parts where she had no lesion at all in the beginning, but now she developed, right? But still they persisted with our treatment. So in between she had pain abdomen, and then for that purpose as SOS we gave Hingvastaka Churna, and Nalpamradi was replaced with Manjistadi Taila. You can see this is I'm very fortunate for having patients, very cooperative patients. Whenever I ask them, they send the photographs and all through mail or WhatsApp. This is on WhatsApp. You can see 4 days, no steroids since 7 days. And we stopped Kashaya, Bilwadi, and Dushivisha was continued. Nalpamaradi was reintroduced. See, 4th November, only Dushivisha and Nalpamaradi is there. Mid of the November, only Nalpamaradi is there. So 22nd January, 29th March. Why you had done so much of follow-up? Because this was needed for this case. Because leukocytoclastic vasculitis is such a condition where recurrence is very high. Even a person who had history of leukocytoclastic vasculitis, if in future it gets bitten by a mosquito also, there is a more than 50% chance of developing leukocytoclastic vasculitis. Okay, and we wanted to publish this one. For that purpose, we did so much of follow. And very importantly, this article is accepted maybe in January or February it will be published. Okay, same patient, you can see we did follow. This is again another patient. Here also see, this was diagnosed as leukocytoclastic vasculitis. Again, treated with modern medicine. There was no change at all. By profession, he was a safari driver. Means the people who take people, the person who takes people in the forest and all safari, that type. Okay. So when he came to us, he was diagnosed and he was on steroids and all, but it was not reducing. Nobody tried to examine us. So here you can see, this part you can see, there is a black brown spot. Like this, he had 3, 1, here 1, 2, here 3. He had 3 spots. These are the signs of Pittaja, Kitavisha, where in Pittaja Luta, if you study, in Luta Visha Samanya Lakshana, that is Krishna Madhye, means when Pitta dominant Visha, Kitavisha is there, at the site of contact, there will be necrotic changes. Because of that, there will be this type of discoloration. Okay, this patient, again, we treated with same medicine. See, Patola Katranadi, Bilwadi, Dushivisha. Right? Patola Katranadi, Bilwadi, Dushivisha. Only thing here it is, we have given it 5 times. That was a kid of 10 years, under 10 or 11. So the quantity as well as the doses were less. Here the patient is adult. We needed more viration effect. Same Patola Katranadi given in multiple doses. Bilwadi also given in multiple doses. Okay. Next, as per the clinical presentations, we changed the Patola Katranadi to Gudichari Kashaya. The Shangagada was not available on the first day. If it was available, we would have got better results in a less time compared to this. and we got Dashanga Gada, and that was added. Patient had pain in joint, so for that Dashanga Lepa was given. Okay. Now you can see the outcome 18, 19, 22. This stains will take more time. This is because it is nothing but extravasation of the blood only. The adjacent skin will be stained. That takes some maybe some 10-12 days to come back to the normal skin color. So how many days we treated? 5 days. But what amount of medicine we have given? We have given medicines which is enough for some 20 days. So Muhurmuhu Aushadha Sevana Kala is recommended for Visha. So that is why we gave that much. Again, what we have given? Kotalakatranadi, Bilwadi, Dushivishari, Nalkamaradi, and Gudichadi was added in this, right? Okay. Now, there was one more 𝐾𝐞𝐫𝐢𝐧𝐭 and all contact poisoning. I told I will show you some more also. Now, there is one more condition like dermatological manifestations due to Dushivisha and Garavisha, right? Now, for this, we need to understand the lakshanas of Dushivisha. There are two sets of lakshanas or definitions. Like Dushitam Desha Kalana. There is one Dushitam Desha Kalana Diva Swapna Rabhishna Shaya Asma Dushite Datun. That is there. Na? So that is one. Another one is Jirnam Vishagnoshadvir Hatama. Now, when we look into that, Dushitam Desha Kalana Diva Swapna Rabhishna Shaya, sorry, there is a train track nearby my home. That disturbance will be there. The train is coming now, maybe. Okay. So when we consider that Dushitam Desha Kalana Diva Swapna Rabhishna Shaya, if we go to the types of Anumana, there are two Anumanas like Karyat Karnanumana, Karanat Karyanumana, right? So that definition, Dushitam Desha Kalana Diva Swapna Rabhishna, it gives idea that the person is already having Dushivisha inside the body. So when environmental changes, diet changes will be there, at that time the internal Dushivisha is getting potentiated and then manifesting the clinical presentation, right? So this means what we are coming to know here, Karyat Karananumana, right? We don't know what the patient has been exposed to, but we know why the clinical presentations are coming. Right? Means clinical presentations are karya. So by seeing karya, the nature of the occurrence of the karya, how the clinical presentation is, coming, how it is presenting and all, by seeing that, we are assuming that, or we are doing the anumana that this person is having Dushivisha in the body. Like Mega Dharshana, Amavata, pain is increasing. Like if a patient is having joint pain, so how to understand one of the criteria for that understanding is there we believe, right? Everyone believes there. If it is cloudy climate, rainy is there, so patient is getting more swelling, more pain and all. So it is Amavata, we say there. Same principle we have to use in Dushivisha also. So if we don't know the exposure, but if we are able to elicit the clinical presentations, if we are able to assess the clinical presentations thoroughly, then we can say, because of Karya, we are doing this Anumana. So this patient is having Dushivisha. Now, this patient is from Miras, Satara, I don't know exactly. I'm not remembering because 2016 patient. So this was what was the complaint is the part that get exposed to sun, right? The parts that get exposed to sun, he used to develop this hyperkeratotic lesions with itching. Only the parts that get exposed to the sun. You can see the parts that get exposed to the sunlight, there he used to get these lesions, hyperkeratotic lesions with itching. So now we considered the sun as Dushita Desha Kalana, like a precipitating factor or triggering, and assumed that the patient internally is having Dushivisha, right? We considered it as Dushivisha-janya Vata Kapha Kushta. But it was diagnosed in modern as Darius disease. Okay, it's sometimes it is said to be genetic in origin, something like that, but I'm not sure. I'm not good in modern dermatology. But we consider it as Dushivisha-janya Vata Kapha Kushta. Then we treated with same. We did, we convinced the patient and we thought like, it is recurring. No? Whenever a patient is going outside sun, he stopped, I think 6 months or 7 months, he stopped the college. He had this since the age of 8, I think. Now he is 17. No, not 17. This was in 2013 and this is in 2016, means 17 plus T, 20. But he is having this complaint since the age of 8, I think, since the age of 8. So he has to wear full dress. He has to cover the face and all. He never used to go outside without means on shorts and all, full sleeve shirts and all. Even then, simple, just a part that get exposed to sun, he used to develop that one. Okay. So for that purpose, we convinced and we did Virechana. Kalyanakagrita as Kapha Vata dominant presentation, and Vishagna is also there. Yeladi Taila, Kapha Vata Hara, Vishagna. Trirut Leha with Draksha Jala Virechana was done. And for the Shamana, we gave Patala Katranadi, Gudichadi, Dushivishari, and Yeladi Taila. Why Patala Katranadi is not, Pitta is not there? Like, hyperkeratinization is a kind of conversion into Paka, Kharapaka. Consider it as Kharapaka. Now, Paka is rendered by Pitta. When it becomes more associated with Vata, at that time it leads to Kharapaka type of. Kharatva is brought in that. So, Kapha is Shoshana. Kapha Shoshana is done to such an extent. So, for that, correcting that Pitta, this medicine was given. Second visit, Patala Katranadi, Manjistadi Kada, Mahamanjistadi Kada, Dushivishari, Eladi. Third visit, Kalyanakagrita is Shamana Sneha, Sarivadyasoa, Dushivishari, Eladi Taila, and Manjistadi Taila. Eladi before bath, Manjistadi after bath, it was given. This you can see the 25th February after 8 months. You can see. Very important is he is now walking under the sun, even on shorts, wearing banyan, like no restriction of solar exposure at all now. You see other parts, you can see hands and all, right? He was completely all right. So how we treated him? We treated him based on the concept of Dushivisha, right? Now here one more case, Garajanya. This I will run in fast. This is a very big details are there. So this lady is having scaly lesions all over the body, swelling and all. She is not able to, this patient was actually discharged from our own modern hospital that we cannot treat her. She had acidosis and all. Okay, you can see scaly lesions all over the body. Like what happened is she went to a modern doctor for this OA. She had severe knee joint pain, and then she went for that and she took some treatment. In the beginning, they gave some injection and some medicines. In a week, what happened? She started developing with that drug. She started developing urticarial rashes. So then she consulted the doctor back, and the doctor stopped that NSAIDs and gave some this antihistaminic, and it reduced. Again, they reintroduced that NSAIDs. But this time, what happened? That urticaria started converting into exfoliative type one, skin peeling and all. Then she was taken to our modern hospital, where it was diagnosed as DRESS syndrome. It was diagnosed as DRESS syndrome. DRESS syndrome is drug. 1 minute, somewhere I've added. I'm not good with modern. Somewhere in biopsy, as per the morphology, it was diagnosed as erythroderma. And she had even diabetic ketoacidosis. She was non-diabetic. But what happened to treat that drug-induced DRESS syndrome? She was given huge doses of steroids continuously for, I think, 3-4 months. She was on that. So because of that, she developed a kind of iatrogenic or Vaidyakrita aparadha diabetes, and then she developed this ketoacidosis. And so it is DRESS syndrome, drug-induced something is there, reaction with eosinophilia and systemic presentations due to NSAIDs. Here it is, somewhere it is, just a minute. Drug reaction with eosinophilia and systemic symptoms secondary to some drugs, that is NSAIDs. Okay, this is DRESS syndrome. Sorry, I'm not good with modern. Okay, so what was there for us to manage from this is there is scaling, erythema, burning sensation, pain, fever, vomiting, and weakness, and there is history of drug allergy. Okay, so what we did, we considered it as Charmadala, which suits for the clinical presentation. It is again Pitta. Here it is, explanation about drug-induced, this one. Okay. Okay, we started the treatment like, Jwaragna and Dushivishagna. Jwaragna and Vishagna. So we started with Amrututtra Kashaya, Bilwadegada, Punarnavadi Kashaya. Like this same change and all where we made. We made some changes in that. And we treated her very effectively and successfully. With the same, in this, what we considered it, we consider it as Garajanya Dushivisha. Like we consider the medicines as the Kritrima Visha, and it is low potent. So Garajanya Dushivisha. Here I will tell the principle. Okay. Now diagnosis, like etiologically based, it was considered as Dushivisha, as there is a DRESS syndrome, is drug induced due to NSAID. So that Dushivisha means Gara type of one. There is scaling and erythema, Paka or premature aging of the tissue, for which I consider as Pitta is responsible. So for that, Pitta was given more importance. He had fever also, so Jwaragna Chikitsa was, the concentration was done on that. Ketoacidosis, like sometimes, keeping things simple is very important. Now, ketoacidosis, if you read, and then if you read Vidagdhajirna, it suits very much with the Vidagdhajirna. So, Jwara Chikitsa, in case of acidosis, ketoacidosis and all, 100% works. And we have not given anything additional for particularly targeting that acidosis and all. So, we have treated it Jwaragna and Vishagna Chikitsa. Line of treatment adopted was Dushivisha and Jwaragna. And we got this outcome. Okay, this is a girl. When she came to us, she was 21 and she developed this one. This is Erythema annulare centrifuga, a modern name. This was caused at the age of 10 or 11. She was given penicillin injection. At that time, she developed allergic rashes, and since then, she started developing this. What is the presentation is here? This scaling with itching. Whenever she gets exposed to cold, whenever she drinks coffee, she eats this chocolate, or whenever she takes any NSAIDs or paracetamol, at that time she used to get these things. So we treated her with, this was the presentation, we treated her with Dushivisha Regada and Patolomuladi. Actually, I insisted for Virechana and she was reluctant to take Grita. So for that purpose, it was given like, 1 month Dushivishari dena hai, then for 8 days or 9 days Patolomuladi dena hai saath mein. Then we have to stop the Patolomuladi, 1 month continuously Dushivishari, then a gap, then 2 months, like that, again a month gap, and like that. For like this, we did for 2 or 3 months, and she was perfectly all right. Actually, this should not be the what you can say is the image of post treatment, because this is not the outcome. The outcome is you after taking this treatment, whether she eats ice cream, whether there is skin presentation, on taking NSAIDs, whether there is skin presentation, like that. So she completely got rid of that, right? So what was the reason? We considered that drug induced as again Dushivisha or Garavisha, Garajanya Dushivisha, or low potent Garavisha. It is nothing but Dushivisha. Like that we treated. This is a food induced allergy, right? He had a student, one of our college student, he had food outside in the dhaba, something. So he developed this one, rashes. In 1 day, he developed all this. And all what I gave Patolokatrina, because actually I wanted to give Patolomuladi and he was not ready to take that, and simultaneously he was Vata dominant. So it causes severe pain abdomen. So Patolokatrina, Dushivishari, coconut oil was given for excellent application. This is 3rd day, less itching and no redness. You can see this is on after treatment, 6th day. He is perfectly all right. Right? Again, what principle was used? Shamana, Prashamana, and Aushada. Aushada is Dushivishari Agada. Prashamana is that Patolakatrina and coconut oil, right? Okay, this is I think very commonly I have shown this one. This 𝐾𝐸𝐻, based on 𝐾𝐸𝐻 concept, we treated. This patient was diagnosed as erythema nodosum leprosum, a type of leprosy. This entire foot, he had no sensation at all. There is no sensation at all. And he was treated with the modern treatment protocol, that Dapsone and all. And he developed these 8 months and all. These lesions on right leg, he developed just since 10 days or so. Okay. So this was the treatment he was on he has been treated for more than 6 months or so. And there was no relief. And then somehow he found our name and he came to us. So when he came to me at that time, I was more consistent, interested to know this part. And when I asked about this, he told that he used to keep these legs apart by keeping a pillow or something. So, but once what happened, accidentally, his left leg came in contact with the right leg and he developed this one. Okay, in 3 days he developed. So we consider it as Kledeni Espeshitangam Tatrapi Kurtevrinam, Lutavisha, right? The Samanya Lutavisha Lakshana last line says, Kledeni Espeshitangam Tatrapi Kurtevrinam, means where the secretions of current lesion come in contact, their new lesions are caused. Whether the patient is having, Lutavisha bite is there, contact is there, no matter, nothing. One of the principle is working there, means Karyat Karnamana, right? The principle of Kledeni Espeshitangam Tatrapi Kurtevrinam is working there, means when a Kleda is coming in contact with other part, new lesions are caused, means there must be Lutavisha, because Acharya has told Kledeni Espeshitangam Tatrapi Kurtevrinam. So I forgot about what was the modern diagnosis, that leprosy and all, but we took care not to directly touch and all. We kept the patient separately. So what again given? Patolakatrina, Dashanga, Triflaseka, Parentaditale. It is instead of this, even Alpamrad is also okay. This is explained in the context of Mandali Visha, which was available at that time, so it was used. So complaints started reducing, and we replaced the Dashanga with Dushivisha Regada. And see, on 12th October, medicines were revised. Dashanga Gada Chandana, he was having burning sensation. Actually, that burning was complaint for him on the left foot. But for us, it was a good sign because that was the part where he had no sensation at all. So Chandana Lepa and Paranthadi Taila. 16th, all complaint reduced. He had tingling sensation over big toe and second toe of the affected foot, and patient was discharged. This is the presentation on 16th. We started the treatment on 2nd October. Admitted on 5th October. 2nd October, we started the treatment. Right, this is the outcome. The follow-up medicine was Chandana Sav, Dushivisha, Paranthadi Taila for extra application, and all medicines were given for 10 days. And we asked the patient to come on 27th as per the OPD date. And very importantly, he came on 27th. You can see on 27th. The 27th, all the Lakshanas are reduced. He is having perfectly, has gained all the sensation, everything, and he's going back to the work. And it is just 25 days treatment. No fresh complaints, going to work, no complaint concerned with reduced sensation, general condition was improved. As 𝐜𝐮𝐸𝐧𝐭𝐞𝐳, we need to give some Uchavardhaka. And so for that purpose, Tiktagrita 2 teaspoon morning empty stomach it was given. Arigyavardhini 1 BD in between food for maintaining Agni it was given. Okay, he was perfectly all right. Now, here you can see, by showing this patient, if we say, ask the students, what may be the presentation? 100% if we have taught them Padukavisha, they will diagnose it as Padukavisha. Then we have to ask, what is the dosha? Right? Patient has not applied anything here, oil and all. So now this much, clay is there, presentation. So if we ask 100%, they will tell kapha is this much or it is more, kapha is like that, can be straightforward. This article we have published, it is there. So what was done? Trifla Seka for first days, Trifla. And next we got Lodrisya Vyadhi and we did Lodrisya Vyadhi. And after Seka, we applied Nalpamaradi. Shamanaushadhi, Arigyavardhini, Bilwadi, Punarnavasva and Lohasa was given. Patula Katranadi, it was given on empty stomach. Now for 10 days, follow-up medicine, Kalyanakagrita, empty stomach Shamanasneha, Elagital action application, Arigyavardhini for Deepanapachan. This is after a month or so, or 1.5 months, I'm not sure. Date is not there, I think. So second follow-up for 10 days again, IS-Kriti I usually give for bringing back the normal color. IS-Kriti, Lagusut and he was little bit anemic also. So for that purpose, it was done. This was, for that purpose, we admitted the patient and we did Virechana also. This is admitted, at this time, we admitted the patient for Virechana. Virechana was done for preventing, because he is a farmer. He goes, farmer means not so old. He's young, 17, 18, 19, maybe in that only, but he's not into education. So Snehapana we did with Kalyanakagrita, Elaitya Labbenga, Virechana with Rutleha, and Samsajana Krama was given for 2 days. Follow-up medicine was IS-Kriti, Manjishta Taila. This was the last photograph which we got from him, right? Now this is a surgeon, ophthalmic surgeon. He is having diagnosed as Amar psoriasis, but he developed this because of gloves allergy. Now, it is one of the most, disturbing for his profession. And when he came to us, he was suffering from this for 2 to 3 years and he was not doing any surgeries and all. Okay, because he was not able to wear the gloves. When he came to us, I gave him Tiktagrita, Dushivisha and Arigyavardhini, Nalpamaradi for action application. 1.5 months or 2 months we gave and he's perfectly all right. I treated him in the 2012 or 13 and he's still in contact with me and he has never developed again, but he's using the same gloves. Okay, so when we treat for the Hetu, 100% we get this kind of outcome. Now there is in clinics, this is in clinics, 20 hours clinic is there. Dermatological manifestations due to Visha, contact poisoning, Padukavisha and all, bites and stings, contact dermatitis. Recording 10 cases based on the case-based teaching or OPD or IPD exposure. Okay. Now this here, what is said, if you don't have OPD, no problem. Whatever resources you have used for case-based teaching, you can use them also. See, I was telling that we are planning to give, recently I met Prasad sir in Delhi and I was telling like this about what to do about this. So same case, what we discussed. Now this patient, this will be one side, 2 faces. One side, the photograph is there, back side, there is history details of that. Okay. Now this patient photograph will come with this type of, it's not actually problem-based. In the beginning, we thought it is problem-based. Now it is considered to be as case-based. So now these are laminated. So no, why to waste money like that? We have not changed. Now in this, the case will be like a patient came with the complaints of oozing, crusting, discoloration associated with itching pain, occasional burning sensation over dorsum of both the legs since 2.5 months. 3 months back, patient used new footwear and developed itching over the both legs. legs after changed the footwear during this time. Patient walked in the field of Parthenium also. So simultaneously he changed the footwear, but simultaneously he walked in the field having Parthenium and it got aggravated. Now this is the condition. Now we have to frame questions. These things, when you will get these things, you frame your questions based on the level at which you are teaching. Like first time your students are being exposed, ask them simply, if you are taught Padakavisha, ask them the diagnosis. Next time you ask them to assess the dosha. Next time when you have completed the treatment aspect, at that time you just tell them to write the treatment principles. Like Vishagna, Kledahara, Pushtagna, Kandugna, Shwetagna. That is also enough. Okay. Like the patient with 𝐾𝐞𝐫𝐢𝐧𝐭𝐞𝐽 that I have shown. This is because I have scanned them. That is why this color and all this much. Otherwise, the photos are like that, what I have shown in PowerPoint. Severe burning sensation with elevated erythematous lesions. Like this explanation will be there. History will be there. Based on that, you will be framing your questions. You will be framing your own things for teaching, how best you can use them, right? This is how I have developed almost more than 150 are there, but most of them are like dermatological other than Agada. But I have told the sir how to send is not clear. So sir has told me to now prepare as a ebook. So maybe another 15-20 days, maybe by the end of December, I will be able to give that, prepare that ebook. Then who will circulate it is not sure, whether it will be sent by NCSM or they will ask me to send, or they will ask me to upload anywhere, something, it's not clear. But anyhow, by the end of December, you all will get these type of things. Hope that will help. Okay, by giving that, I'm not telling that I'm something different. No, it is a kind of opportunity I got to learn under such people, and simultaneously I got the opportunity to, against all odds, I got OPD, and I got a full support of our principal sir at that time, Prasad sir. And because of that, it was possible for me. Anyone who got so much of support and all would have done it. Okay, it's not like showing anything extra, something like that. It is for the sake of the science, for the sake of Agatantra. When people say Agatantra, what you can do, people always say here also Visha, there also Visha, like that. In something like that, I say no problem. You don't want to accept, don't accept. No problem. We accept and we treat. So this is called a silent. You work in silence. Light will come to all, right? So I think that is it. Thank you. Now we can be for discussion. Surely not for debate. Okay, discussion. We'll have discussion. Okay, I completed in 1 hour.
Thank you, Mahesh sir. This session is open for discussion. If anybody has any questions to Mahesh sir, you
Thank
can
you, ma'am.
ask it and get your answers.
Hello.
Yes, Mahesh sir.
Somebody said something. It was not clear for me. I think it will be good if you text in the chat. If voice is not clear, somebody was telling something, but it was not audible clearly.
Mauneshwari madam, please ask. I think Mauneshwari madam.
Sarita madam is asking, can we add some skin allergies due to air pollution? Yes, ma'am, no problem. Like only thing is, their principle will be same, like dosha and hetu. Okay, for hetu, what we are giving, we have to use some Vishagna Dravya, and for the Lakshanas, we have to use Prashamana. Now, air pollution, whatever it is, not necessary that when it comes to teaching case-based learning, you should teach Paduka Visha, Abharana Visha. No, not necessary like that. What is important is whichever case you get as a result of some contact poisoning or Dushivisha or Garavisha, allergic, you take them and teach the students. That is what. Okay. There is no restriction that 100% you have to teach that only. No, for theory, you will be teaching that. But when it comes to case-based learning, based on this concept, we can treat these also like that. If we teach, that will be a great, what you can call, no, knowledge for the students. Even if you document those things, and in future, they can be shared with, many other people also. So that will help others also to learn and teach also. Can you explain about repeated medications? How you are adding practically, especially in the case of Kashaya, what will be the dosage, timings? Sir, actually, the repeated administration means by seeing the condition, like in that leukocytoclastic vasculitis patient, when you see the condition, I felt it is very severe and more pitta-reaching effect was needed. So for that purpose, that 15 ml what Patolakatoneri we give, same was given 5 times. Okay, same was given 5 times. For example, we had a case of multiple honeybee sting on the scalp. And when patient, lady, she was Anganwadi worker, when she was, keeping these firewood for, next day, midday meal, I think, she got stung by multiple honeybees on her scalp, and she came to our hospital around 6 in the evening. She had, kind of little bit slurred speech, mild orientation was not proper, mild ptosis was there. Then I asked our PGs if you are able to handle the patient, like be with the patient till morning, we can admit. So our students agreed. We gave Dashanga Gada Patolakatonadi Kashaya. Like we started the treatment, first dose of Patolakatonadi was given around 6:30, 6:40. And by the time 12:30, patient was given 200 ml of Patolakatonadi Kashaya and 5 or 6 Dashanga Gada were given. And 2 times Sita Jala Shira Sheka was done in the bed only. Okay. Next day morning, 8 o'clock, patient was discharged. Means requirement was like that. Means the tikshnata of the condition. This you can learn by just seeing the severity of the condition. Just if you see the condition is more severe, increase the dose. If you feel condition is not that severe, you can reduce. But simultaneously, you should keep the idea, you should have the idea of Rogi Bala also. Like I told in kid, we cannot give, severity was more compared to that male patient, adult patient, it was more severe in that kid. But there the patient bala, that kid should not be given that much, virechaka dravya. Actually, virechana should not be given. So that is why the dose was less. So bala of the roga and rogi bala, if we consider, it can be done. Can you provide list of medicines which are market available and used in dermatological condition? The madam, whichever I have used, all these are available in market. All the medicines are available. Only thing in Agadas available are Dushivisha Agada, Dashanga Agada, and Bilwadi Agada. And some pharmaceutical companies are manufacturing even Murvadi Agada also. Okay, Murvadi Agada is also very good in GI manifestations. Line of treatment for acne vulgaris. Madam, again, like line of treatment for that clinical presentations we have to see. I usually give, like, if it is more Kleda Yukta, more, pus and all is there, I go with Nimbadi Kashaya, Nimbadi Gugulu, Trifla Seka. Don't give Panchavalkala Seka, because I had a bad experience. One patient was having lots of pus and all, I give Panchavalkala Seka. Pus and all reduced, but patient became, face become highly, dark, and he was complaining of that. Okay, so don't give that. And then depending on the nature, if it is too hard, you can go with Varnadi Kashaya. Again, you can go with Asanadi Kashaya also. So Dashang Agada, sorry, Nimbadi Gugulu or Bilwadi Agada can also be added. External, in the beginning, almost till the patient gets rid of the pimples, do not give for any lepa. Don't go for any, cream and all. Best is repeated washing with the kashayas, like Tishla Kashaya and all. Patola Kashaya Nadi Kashaya tablet administered in any of these conditions? No, sir. Actually, I do not use kashayas in tablet form. I have not, I don't have any idea of that. And today only I prescribed one patient. That patient insisted on tablet. So I gave the tablet. It's not available with us. I told them to purchase from online. So I told her, first day you take one tablet, one in the morning, one in the evening on empty stomach. But I don't know, because how many, if we give one tablet, what will be the outcome? I don't know. So that is why I do not use. But all these are available. Maximum kashayas are available in kashaya form and as well as kashaya tablet form also. If cause is unknown, the patient is not cleared in the history taking, can such cases be treated on the basis of Agada concept? Now, just a minute. I would like to show something here. Just a minute, I'm finding one thing. This slide is visible? I think it is visible for all.
Yes.
No. Okay, just a minute. Now, this is naturally Viruddha, right? One of the Kushtakara Nidana. Meat with the milk products, right? Now, this is classically Viruddha. Okay, if a condition is caused by this, a pure 𝐾𝐽 line of treatment can be given. Okay, think it's pure 𝐾𝐽 line of treatment is given. We don't know our patient is having Visha exposure or not, but come with some skin manifestation. Now, present day, what it comes. Now, aquatic animals come with heavy metals, residues of heavy metals. The meat, red meat and all comes with medicines, growth hormones, steroids. The milk products come with lots of adulterants. Right? Now, it is classically Viruddha and it is coming with these things. Can we call it as same Viruddha? Samanya Viruddha? Take another example. Like, for example, banana and milk, we call it as Viruddha naturally, right? It's going to cause more aberration, against skin diseases. Now, what is present day? Milk, adulterants. Banana comes with calcium carbide. Calcium carbide is used for ripening the bananas. And there are so many studies which are published in reputed journals that the calcium carbide that is used for ripening fruits is not only touching the, what is that, cover only. It has gained entry into the fruit itself. Right? That is why these banana and all, they get decayed. Now, can we call this again as a Samanya, Viruddha? No. It's not Samanya Viruddha. It is Savisha Viruddha. So, irrespective of, the thing what we are getting exposed, we are 100% getting exposed to, one or other Viruddha. So, for that purpose, I always tell that no need to worry whether if the patient is not having Visha, patient is having Visha or not, whether we have to think on that or no. Unavoidably, we are getting exposed. Even our toothpaste contains 3 EDCs, endocrine disruptive, chemicals, and it contains carcinogens also, which we start our day, and the mosquito repellents and all that we use, that is also toxic. And all the things are unavoidably getting contaminated with Visha. So don't hesitate to treat with Vishagna Chikitsa in all patients. I don't mind giving Agada in all the patients, right? Some of the junior faculty in our college in other departments like Prasuti or in who are in infertility, who are in Kaichiksa, they too have started using Dushivisha and Bilwadi now because of this type of understanding, right? I think that is clear. Sir, can you please explain about post-herpetic neuralgia, post-psoriatic arthritis? These are a little bit very, I think, specific. Let me find something like that. If it is okay, I will show you. Just one patient. I was telling like, 𝐾𝐸𝐫𝐢𝐧𝐭𝐞𝐳 Chikitsa we have to use. So when we use 𝐾𝐸𝐫𝐢𝐧𝐭𝐞𝐳 Chikitsa, in somewhere I had that. Light is visible? Maybe I think it's visible.
Yes.
Okay, now this patient aged 76, 3/7/2023, right? This patient was aged 76, came to me with a severe pain and my handwriting is not good. Okay, this is my personal register in OPD I maintain. Burning sensation from the center of the back to the middle of the abdomen on the left side since 2 months. History of herpes in the month of the May. Means 2 months back he had herpes. Same part he is having the complaints. Now what medicines I gave him? I gave him Tiktakagrita, Arigvardhini as Dipanapachana, Tiktaka Shamana Sneha, Vilvadi Gulika, 𝐜𝐮𝐳𝐧𝐭𝐬 was given. Now what is the understanding is I told like all vesicular bullous disorders you can treat with Lutavisha Chikitsa or 𝐾𝐸𝐫𝐢𝐧𝐭𝐞𝐳 Chikitsa. Now 𝐾𝐸𝐫𝐢𝐧 or Lutavisha is cytotoxic as well as neurotoxic simultaneously. So if our agadas are said to be submec bhaishija, then they will be correcting both cytotoxicity as well as neurotoxicity, right? So that is why we get that type of. So because of that, whenever I told whenever we have treated herpes with a 𝐾𝐸𝐫𝐢𝐧 Chikitsa, none of our patients had developed this post-herpetic neuralgia. Now this patient with post-herpetic neuralgia, same principle we have to apply. Right? Now, Vata Prakopa is there. For that, what I gave? I gave Tiktagrita as Shamana Sneha. 1 teaspoon means around 10 ml in the morning. And for Dipana Pachana, you can give Arigvardhini, you can give Mahasudarshanavati, Chitrakadivati, depending on the suitability of the patient. And Vilvari Gulika as a 𝐾𝐸𝐫𝐢𝐧 or Vishagna. 𝐜𝐮𝐳𝐽 external application. Right? It was given on 3/7. You can see sleep is disturbed. Huh? Now, he was going back to his native place. He was from Athani and he came to his son for the consultation of this only. He was in Khanapur. So I told him to stay here for a week and then you can go. We can see the changes at least. So he came on 12th after 5 days. You can see pain and burning sensation has reduced by 70%. No fresh complaints. Sleep is good. What we gave? Tiktagrita, Arigvardhini, Vilvadi and 𝐜𝐮𝐳𝐽 type. Right? He was given modern medicines and all. Right? It was on 12/7 and I continued with the same medicine. And he was perfectly all right. I usually take like this. I took the phone number and we called after 10 days or so. He was perfectly all right. No post-herpetic neuralgia. Okay. So again, in post-herpetic neuralgia also, you go with 𝐾𝐸𝐫𝐢𝐧𝐭𝐞𝐳 Chikitsa. If I had Bilwadi in place of Bilwadi, if I had Dashanga, I would have got still better outcome in shorter time. Because previously I have treated few patients. One patient was having post-herpetic neuralgia from oral cavity, eye, nose, and like this it was. Okay, he was having that for I think 1.5 years or so. He was diabetic. For him, I gave Tiktagrita, Arigvardhini, Dashangagada. Okay, no external application was going in that patient because it was not possible because internal. Okay, 1.5 month I think we have treated. It was very severe in that patient, but medicine was same. Arigvardhini in between we stopped. Dashanga also in between we stopped, but Grita was maintained. So he was perfectly all right with that. I think it is okay, right? Can Rasayana be used to avoid recurrence of manifestations like atopic dermatitis and others? Yes, no problem. But best way is to avoid those things is use of Dushivisha Agada. If you use Dushivisha Agada, you will get, where I lost my image. Okay, if you use Dushivisha Agada, you will get best preventive effect in such conditions. Okay. Okay.
I hope.
Okay, I think there are no more questions. Thank you everyone for participating and listening me with presence. Thank you. Thank you.
Thank you, sir.
Thank you, sir.
Shobha Bhatt, madam, shall we go with the vote of thanks?
Yes, sir. Please proceed.
Yes. Thank you, today's guest speaker, Dr. Mahesh Savalagimath, sir, sharing his valuable experience and knowledge to all the esteemed members of Vishwa Ayurveda Parishad members. Thank you. Thank you. I thank once again VAP-Sambhasha executive members, especially convener Professor Shobha Bhatt madam, she is all around this program success. I thank Shobha Bhatt madam and co-convener Dr. Sandeep Binorkar and Dr. Ashish Goswami sir. I also thank zonal wise coordinators North Shankar Sherin Mishra, East Dr. Santosh Vishwakar, in the Central Zone Nitin Urmalia, in the Uttar Pradesh and Uttarakhand Dr. Madhu Patak, Western Bengal and North Professor Parmeshwar Rawat. And lastly, I thank the VAP Executive Committee members, Vishwa Ayurveda National Executive Committee members, Professor Govinda Shukla sir, President, General Secretary Professor Mahesh Vyas sir, and Organizing Secretary Professor Yogesh Chandramisha sir, and Joint Organizing Secretary Professor 𝐾𝐞𝐫𝐢𝐧𝐠 sir. Once again, I thank all the esteemed members who has patiently with this program, and I think they all take the good message, and I hope with the practice of Agatha principle in their OPD practice. Thank you one and all, and thanks. We will go with I think Shobha madam will go with the Shanti mantra.
Yes, sir. Please continue.
Yes. Shanti mantra. Om Do Shanti, Antariksha Shanti, Prithvi Shanti, Apa Shanti, Ishadaya Shanti, Vanaspatya Shanti, Vishve Deva Shanti, Brahma Shanti, Sarva Shanti, Shanti Reva Shanti, Sama Shanti Redi. Om Shanti Shanti Shanti. Once again, I thank all the VAP Vishwa Ayurveda Parishad members and executive members, and all the esteemed members, and the people who have, especially teachers and